So continuation to the discussion. So diabetes mellitus. So type 1 diabetes mellitus is absolutely no insulin. So our pancreas does not secrete or produce enough insulin to uh, to synthesize the glucose in our body. So insulin, so it is needed to have an insulin therapy. So the management of it is insulin therapy. So type 2 is insufficient insulin. When we say insufficient insulin is our insulin is not enough to, so insufficient insulin is our insulin is not enough to stimulate the glucose in our bloodstream. So this will lead to or results to obese. So it is needed to, the management of this is the oral hypoglycemic agent or OHA to stimulate the pancreas to produce insulin. So diet is 50% CHO, carbon, nitrogen, oxygen, 30% fats, and 20% CHON. So exercise increase uptake of glucose. So when you exercise, your body needs more energy. So the glucose in the glucose stored in our body will be used. So that's why decrease insulin requirement. So exercise is a must to increase the uptake of glucose. So oral hypoglycemic agent OHA, this classification of drugs stimulates pancreas to produce insulin. Example, metformin. So insulin. So insulin administration usually through subcutaneous, but if it is a DKA or diabetic ketoacidosis, so the insulin is administered through intravenous, because in intravenous the insulin were immediately act through the peripheral intravenous. So never massage the area after administration, never administer cold insulin, because administration of cold insulin will cause pain. So rotate the site of injection to prevent lipodystrophy. So lipodystrophy is the accumulation of fats in the injection site. So it is needed to rotate the injection site, the site of injection, to prevent this. So during mix of insulin, there are two types, which is the NPH, the immediate insulin, and regular insulin. So aspirate clear first, then inject air to cloudly first. So first is we need to aspirate air to the desired units, then release it to the NPH, immediate insulin, then in the regular insulin. So first aspirate is in regular, then after the NPH. So hypoglycemia. So the signs of hypoglycemia is weakness, hunger pangs. Hunger pangs is the body, the glucose of our bloodstream is decreased. So hunger pangs is the person is having a desire to eat that cause an abdominal pain. Then A is alteration of LOC, because glucose function is as fuel in the human body. So glucose is like a fuel in the human body. So if ever na dili enough atong glucose levels ato ang bloodstream, so our body will not function well. So it will affect our level of consciousness. So tachycardia, tremor. So as I said, it is the fuel of our body. So it will cause increased cardiac rate and involuntary handshaking or tremor. So the symptoms of it is abdominal pain, blurring of vision, cold clumsy skin, and diaphoresis. Diaphoresis is excessive or abnormal sweating. So if there's an occurrence of hypoglycemia, we need to give simple sugar such as orange juice. So DKA or diabetic ketoacidosis. So increased lipolysis, increased ketone. So muna siyang management sa DKA. So hyperglycemia. So hyper is too much glucose in our body. So that would lead to polyuria, excessive urination, polydipsia. Polydipsia is excessive thirsty. Then polyphagia is excessive hunger. Then small breathing is fast, deep breathing, like unusual breathing, just glycosuria, ketonuria, and warm flush skin. So if the person is experiencing hyperglycemia, so these symptoms will appear. Why there is a polyuria or excessive urination? Because the glucose or our fluids in the body cannot circulate well because of the structure sa atong blood na it cannot circulate well due to increase of glucose in it. So next is glycosylated hemoglobin. This is a test that reflects blood glucose level for the past 3 to 4 months. So it is needed to have a glycosylated hemoglobin test for the past 3 to 4 months. This is the most accurate to determine the level of glucose in the bloodstream. So foot care. So in diabetic patient or individuals, foot care is a must. So podiatrists avoid removing corns and calluses, cut toenails straight across, avoid walking barefoot, because if there is an occurrence of wound, it would lead to ulcers because poor circulations are present in individuals who have diabetes, because ang ilahang blood is cannot circulate well, kay medyo lapot siya, kay wala man siya na synthesize sa insulin. So wala siya kumbaga na sa ato ang insulin. So poor circulation mo tong mag-contribute siya sa poor healing sa wound if ever na mag-occur. So hepatitis A, fecal oral. So we can get hepatitis A through fecal or foods that kanang wala ta kabalo na giun sa pa-prepare or something na sa naatong bacteria sa hepatitis A. So usually na siya sa mga stool, so it will transfer from person to person through stool. Then ang most commonly is katong plumber. Ang ilang trabaho is plumber. Then hepatitis B, body and bloody secretion. So muna siya sa katong through sexual activities and blood transfusion or sharing needles. So hemodialysis, these are the persons or individuals who are prone to accumulate hepatitis B kung mag-work sila sa hemodialysis. Kaya in hemodialysis, you are filtering the body, the toxins of the blood circulation. So it is more prone. So that's for the diabetic mellitus rather, and hepatitis A and B.